Esophageal cancer is a malignancy that develops in the esophagus, the muscular tube responsible for carrying food and liquids from the throat to the stomach. In this comprehensive guide, we will explore what esophageal cancer is, the standard treatment options available, its seriousness compared to other cancers, the prognosis at different stages, promising therapeutics currently in the FDA approval process, the unique challenges it presents, FDA-approved medications for various types of esophageal cancer, and a list of organizations and resources that provide support for those undergoing esophageal cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is esophageal cancer? Esophageal cancer occurs when malignant cells develop in the lining of the esophagus. There are two primary types, squamous cell carcinoma and adenocarcinoma, each with different risk factors and characteristics. Esophageal cancer often presents at an advanced stage, making early detection and treatment critical. Standard of care treatments for esophageal cancer depends on factors such as the cancer's stage, location, type, and the patient's overall health. Common treatment options include surgery esophagectomy, surgical removal of a portion of the esophagus or the entire esophagus with or without reconstruction using other tissues. Countries outside of the US, such as Japan and Korea, are more advanced in their surgical techniques against esophageal cancer. External beam radiation. High-energy beams are directed at the cancer to kill or shrink cancer cells. Systemic chemotherapy. Medications are used to kill cancer cells throughout the body. Trastuzumab. Used for HER2-positive esophageal cancer, it targets specific proteins involved in cancer cell growth. Immune checkpoint inhibitors, drugs like Keytruda and Opdivo, enhance the immune system's ability to fight cancer cells. An FDA-approved treatment that is dramatically underutilized is photodynamic therapy. This involves staining or injecting the cancer with a photosensitizer like porphyrin, then exposing the tissue to a certain wavelength of light, typically red light, which then activates the photosensitizer and kills the cancer with very few side effects due to the abundance of reactive oxygen species that is produced. Photodynamic therapy, also known as PDT, is used significantly more in countries outside of the US than inside. An over-the-counter pharmaceutical that has shown promise in esophageal cancer is cimetidine, sold under the brand name Tagamet. These treatments and more are described in depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. Seriousness compared to other cancers. Esophageal cancer is considered serious due to several factors. Late diagnosis. It is often diagnosed at an advanced stage, as symptoms may not appear until the cancer has reached an advanced stage. Aggressive nature. Esophageal cancer can be aggressive and may spread to nearby lymph nodes and distant organs, which can limit treatment options. Treatment challenges. Surgical treatment can be complex, and the location of the tumor within the esophagus can affect treatment decisions. Risk factors. Smoking, heavy alcohol consumption, obesity, and chronic acid reflux are common risk factors for esophageal cancer. Prognosis. Prognosis for Stage 1. Esophageal cancer Stage 1. Esophageal cancer is localized to the inner layer of the esophagus and has not spread to nearby lymph nodes or distant organs. The prognosis for Stage 1 esophageal cancer is relatively favorable compared to later stages. With appropriate treatment, including surgery, the 5-year survival rate for Stage 1 esophageal cancer can range from 50% to 80%, depending on factors such as the cancer's type and grade. Prognosis for Stage 4. Esophageal cancer stage. For esophageal cancer indicates that the cancer has spread to distant organs or tissues. The prognosis for stage 4 esophageal cancer is less favorable, with a lower 5-year survival rate. On average, the 5-year survival rate for advanced esophageal cancer may range from 2% to 4%. However, individual outcomes can vary based on factors like treatment response and overall health. Why is esophageal cancer tricky? Esophageal cancer presents unique challenges. Late diagnosis. Symptoms often do not appear until the disease has advanced, leading to late-stage diagnoses. Complex surgery. Surgical removal of the esophagus is a complex procedure with potential complications. Aggressive growth. Esophageal cancer can grow rapidly and metastasize to other organs, making it challenging to treat. Limited early detection. There are currently no routine screening tests for esophageal cancer, unlike some other cancers. FDA-approved medications for esophageal cancer. Several FDA-approved medications are used to treat esophageal cancer, including trastuzumab. Used for HER2-positive esophageal cancer, it targets specific proteins involved in cancer cell growth. Keytruda and Opdivo, immune checkpoint inhibitors that enhance the immune system's response against esophageal cancer cells. Ramucirumab, a targeted therapy used in combination with chemotherapy for advanced esophageal cancer. Atezolizumab and bevacizumab combination therapy, used in combination for the treatment of advanced esophageal cancer. Organizations and resources for esophageal cancer treatment. For individuals and families affected by esophageal cancer, various organizations and resources offer support and information. Esophageal Cancer Action Network, ECAN, provides resources, support and advocacy for esophageal cancer patients and caregivers. American Cancer Society, ACS, offers information on esophageal cancer, treatment options, and support services. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.